Hello and welcome back to the Modern Pain Physician. I'm your host, Dr. Kent, and today we're going to talk about multifidus atrophy, weak back muscles, and the Reactiv8 procedure. So one of the most commonly missed findings on an MRI, and it's hard to know if it's just missed or it's just everyone has it so no one comments on it, are the multifidus muscles, or these kind of stabilizing muscles of the spine. And so as research has kind of progressed through the spine world, the strength of these muscles has become highlighted as basically a cause of degeneration and back pain. Because as these muscles, as they get weak, which can happen as a result of injury, can happen as a result, it's kind of a normal thing that happens as we age, as we do lose muscle mass. And so there is some degree of something called sarcopenia, or basically loss of lean muscle mass as we age, that contributes to this problem. And lastly, people that develop spondylosis, or these degenerative wear and tear problems of the spine, tend to not be as active because of the pain, which can secondarily lead to weakness of these muscles. So when these muscles get weak, you can see them on the MRI. And like I said, if you look closely, usually kind of in that low back area, you can start seeing that the muscles have been replaced with essentially connective tissue and fat. And when these muscles are replaced with basically non-muscle, they're just not as strong as they used to be. And so I talk with folks that usually, those same muscles are just not as developed as they were when they were in their teens and 20s. And so basically you can see these signs of atrophy or loss of muscle, which can lead to back pain. The muscles, and keeping the muscles strong, can overcome a lot of back pain coming from several causes. Just like if you're talking about knee arthritis or recovering from a knee surgery, typically the physical therapy associated with that involves strengthening the muscles around the knee to support that joint. The same thing happens in the spine. You need to have strong muscles around all these little tiny joints in your spine to keep the muscles, to keep the back strong, and to support all the nerve structures and the discs and these facet joints. And when those muscles get weak, then people can start getting pain. The classic, symptom of weak muscle-related back pain are usually folks that are doing things out in front of them. The longer they do it, the more pain they get. The pain just stays in the back. It's usually kind of all over the place in the back, not in one specific location. Can get worse with prolonged walking, can get worse with just prolonged standing, shaving, brushing the teeth. And typically gets better when they sit down. How we try to differentiate this from symptoms of stenosis, spinal stenosis, are that the symptoms just stay in the back. You don't have associated buttock, leg, arm symptoms. It just stays in the low back there. And so it is a very common thing to have, is weakness of the back muscles. The treatment for weak back muscles for forever has been physical therapy and strength training, but for some folks that's just not enough. And so the newest treatment option, which is a very exciting treatment option for folks, is doing what's called a Reactiv8 procedure. In this procedure, essentially I place two electrode wires along nerves in the low back that go to the muscles of the spine. And this is done as an outpatient surgical procedure. Takes about 45 minutes to an hour, not done under general anesthesia. Recovery is very quick, but essentially put these little wires in, and then the patient goes home, recovers, and then for 30 minutes twice a day, essentially the patient hits a button, the muscles of the spine start pulsating, and over time what that does is it kind of refocuses that brain muscle connection to strengthen and basically strengthen those muscles and improve the responsiveness of those muscles. And so they're able to support the body much better, and allow folks to stand longer, walk farther with less symptoms, less pain. When I talk with folks that were considering this procedure, it is not an overnight therapy. I mean, this isn't something like where you burn a nerve in the back and all of a sudden, once you heal up from the procedure, the pain's gone. This is something that really takes time for the muscles to regenerate or kind of get stronger. And so it's a long-term therapy for folks with weakness of those back muscles and those symptoms. It works extremely well, but it is, it does take some time to realize the benefits from that procedure. It's called Reactiv8 again, and it's one of the newest treatment options we have for folks with mechanical back pain or back pain that happens with certain activities that is associated with this muscle weakness or inhibition of these multifidus muscles. And so if you haven't talked with your provider about this procedure, I'd ask them about it. It's for, like I said, for folks with weak back muscles and those symptoms, it works extremely well. It does take a long time, but it is a very effective treatment to regain function from basically weak back pain or weak back muscles causing back pain. And so ask your provider about that, and thanks for coming out of the video and listening to this talk. And